Healthcare facilities face mounting challenges, stricter infection control standards, rising HIA risks, and constant pressure to do more with less. Addressing these complexities requires more than just better cleaning products. It demands a new way of thinking about the surfaces themselves and how they interact with cleaning and disinfection practices. And that's where the Healthcare Surfaces Institute, HSI, comes in. Recently merging with ISSA to form a powerful new healthcare division, HSI brings its deep expertise in surface science, testing, and materials compatibility to the global cleaning community. And to talk about all this, I'm pleased to welcome an expert who works in this field. Linda Lybert, how are you doing today?
I'm great. How are you, Jeff?
I'm good. You are the founder and executive director of HSI. I bet you're a busy person.
I am a very busy person, yes.
Well, thank you for giving up some time today. It's good to have you on the program. Tell us a little bit about what you do and how you ended up at ISSA.
Well, the Healthcare Services Institute, or HSI, was founded 10 years ago. And it was founded based on the fact that surfaces is an overlooked issue in a healthcare environment. And when I say an overlooked issue, people think about cleaning surfaces, but they don't pay attention to how surfaces are connected. They don't look at the materials that they're using. And all of those things can actually lead to supporting microbial contamination. They support attachment. And one of the more important things is oftentimes the materials or the surfaces in a healthcare environment are difficult, if not impossible, to clean. And so the Institute was formed to really start looking at the science of surfaces. How were microbes attaching? How is biofilm forming? How did that contribute to the ability to effectively clean and disinfect a healthcare environment? And we've been around for 10 years and we're making tracks now. 10 years ago, a year ago, we were fortunate to be invited to join ISSA and become part of a healthcare platform, which is what we're here to talk about today.
Well, it's great to have you on board, and thank you for all you do for the industry. But yes, we're here not just to talk about Linda and HSI so much. We're here to talk about some big news. Why don't
Yes.
you tell us all about that?
So the big news is ISSA, while we dabbled in healthcare in the past, has never really has a structured program that they can offer to the building service contractors, to in-house service providers, and to healthcare as a whole. And so we took two other divisions, which is GBAC and also IEHA, and we combined them with HSI into what we call our healthcare platform. And in that healthcare platform now, you will be able to get the best of researchers, advisors. We're working on training programs. We're working on scientific research. We've got some things going on with IFUs right now, which is a huge issue in healthcare. Our training program is going to be much more robust, and we're also offering more hands-on experiences for healthcare providers where we come into the hospital and we actually work with their environmental services teams in helping them understand and learn how to clean the different environments that exist. As you and I both know, healthcare is a really different it's a specialized service when it comes to cleaning and disinfection. It's not like cleaning an office building or a school. It's much more detailed, and you have to be more intent on getting things clean and disinfected. So you really need to understand how you're actually cleaning and you're disinfecting an environment where you really can't see where the issues are because they're microbes that are hidden.
Good information. And you're right. It's a specialized service. We need to focus more on that, and that's what ISSA is doing. You mentioned different divisions coming together, partnering on this. So how will this integration of expertise create a unique advantage in tackling hospital-acquired infections, HAIs, compared to existing initiatives? Because some may be watching, Linda, and go, we already have something in place. We're good. What would you say to that?
So, one of the things that HSI learned many years ago, when we had our very first summit, we asked the people that were in attendance. So, we had people, nurses, directors of nursing, infection prevention, environmental services, value analysis, all of these different areas of expertise in one meeting. And we asked them the exact same question. What do you believe the surfaces issue is? What are your hurdles to success? And where do we start to address the issue? The fascinating thing, each person had 10 minutes to speak and answer those same three questions. Every single person had a different answer and a very different perspective of what the problem was. And when you start to combine that information together, you start to realize where the gaps are and how many different aspects of the problem that exist, and now how to take care of them. So when ISSA brought all of the divisions that had a component in healthcare, when they brought them all together, we now have a powerful offering that not only specializes in infection prevention, in EVS, and also in pandemic readiness, which is what our GBAC division does. We now have an offering that is very comprehensive. And because we're a global company, we actually can work globally with all of our partners throughout the world. And so our mission and our goal is to create a robust EVS, environmental service hygiene program, that addresses many of the issues that we see throughout the world. And we can only do that by being collaborative with other organizations and within our own organization with the different divisions that are already working in healthcare. So a much more robust offering. And the other thing we're doing that is very different is we have a very loud voice of the customer. So we work predominantly with infection preventionists that are currently working in the hospitals. So now we have a real clear view of what is missing. So one of the programs that we're rolling out on August 19th, when we launch our healthcare platform, is actually team gap training, which means we will work with your team in your environment on specific topics that you feel you're missing or what are some of the challenges. And we'll come in with solutions and work hands-on with you to address those. And then we follow you throughout the year to make sure that all of your staff continues to be trained and supported as we continue to address this issue.
Sounds like a lot of work, but a lot of good should come from this. So thank you for all that. One last question. Let's just talk about the future a little bit. Looking ahead, how do you see the ISSA Healthcare Platform influencing policy, regulation, and best practices for environmental hygiene in healthcare over the next 5 years? What do you say to that?
That is a really great question. So one of the issues that we face right now is there are no standards for environmental protocol and processes in a healthcare environment. It's sort of the Wild West. You get a lot of information from World Health Organization, CDC. Many of the organizations have guidelines, and individual healthcare facilities also have specific guidelines that they've created as well. But what works? What's the science behind effectiveness in the process and protocols that are being used in healthcare? ISSA's goal is to start to address that and then advocate for change and the development of foundational standards for all of us to work from. And from there, again, different environments require different things, so we can grow from there. But let's create the foundation first to be able to work from, or we're not going to solve this HAI issue.
Well, let's see what we can do together. Working together, we'll get the word out and try to get everyone on board. But leads me to my final point. Those watching the program here, Linda, what do you want to see them do now?
So there's a couple of things. One, if you're interested in ISSA Healthcare, if you go to our website, you'll be able to see a lot of different information and things you can do. But the work of the platform actually happens within our different task forces. And on the website, you will see the different task forces that currently exist. I mean, they're working in testing and validation. We've got an IFU work group. We've got education and workforce development. Sign up for one of those groups. We'd love to have you get involved. And if it's just information that you're looking for, you'll be able to find a lot on the website. And if you need more or would like more in-depth information, there you can email us or give us a call. We're happy to answer any questions.
Well, Linda, thank you for this. The website you mentioned, I'll put that in the video description below so people can click right to it. Easy to find, easy to access, and get the information they need. Well, we'll get together another time and find out how things are going. But for now, let's see what happens with this platform.